third day I came in here, and I went the next day.
Now, I'm recording this, and we just talked about how happy you were about your neck pain. And you had been diagnosed as having fibromyalgia, right?
Arthritis.
And arthritis.
Fibromyalgia.
Go ahead and tell me the story. What?
I was in a car accident when I was 17 years old.
Okay.
A really bad with a whiplash.
Mm-hmm.
And I had been in pain ever since. Have less neck movement on my right side, and I lived that way for probably 40 years.
Mm-hmm.
Then I went to the Arthritis Foundation because I just couldn't stand the pain anymore, and they did x-rays, they did manipulation, you know, watching to see how I can move, and they said that I had a bad neck. There was nothing they could do, and they would keep me comfortable. So when I would have real bad bouts about it, they put me on anti-inflammatories. I was on Bextra, Celebrex, all kinds of drugs that started doing damage. So I wanted to get off it.
They put you on the Elavil as well.
Yes,
right?
and the Elavil for the fibromyalgia because I kept getting sick, and I just was having a hard time moving my body.
How convinced were they in their diagnosis of fibromyalgia, and how convinced were you that you had it?
Well, they said it's just a diagnosis,
mm-hmm.
and I had 11 out of the 15 points in the body, and I had a lot of muscle aches and pains all the time. I would get sick, be in bed.
Spasms and tenderness and point tenderness, like
yes.
trigger spots and all that.
I had trigger spots all over my
mm-hmm.
body, and
mm-hmm.
I would be so sick in bed that I couldn't get out. And then when I'm in bed that long with the muscle aches,
mm-hmm.
then my neck, my back, everything hurt. So I was really in a bad cycle. So when, and my doctor at the Arthritis Foundation said, there is nothing we can do. We will give you drugs. We will give you steroid injections, and that's the best we can do. You just have a bad back and a bad neck.
And what was your experience with me?
Well,
and with my program, my O'Connor technique, if you call it that.
Well, when you were telling me about it, I was afraid that it wouldn't work. Mm-hmm. I had been in this pain for 50 years by the time I got to you, and I was very leery. I didn't think that it would work. And you worked with me for, gosh, 2.5 hours, just gently moving my neck and my body around and doing a little bit of traction. And I mean, I was scared during it because mm-hmm. I didn't understand, you know, how you were doing it and what you were doing. At the end of when you were done, and I remember putting my feet up on the desk and just laying there, and all of a sudden, I relaxed and my neck popped. And it was like, oh my God, I had no pain, none. And I didn't know how to react because I've had it for 50 years. And all of a sudden, I'm out of pain. I mean, my shoulder was hurting, my elbow was hurting, and all this was going, all the pain from my neck.
Now, did I have you in a chair? And when did your neck pop?
When I just relaxed.
Where was it?
You got me in that chair.
I put you in a chair. See, that was the end of the maneuver.
Yes.
Yeah, that wasn't coincidence. That was part of the deal. That was
okay.
To unweight your neck and reset that. That was part of the whole thing.
So then sitting in that chair where I could recline back,
mm-hmm.
and I just moved my neck, and all of a sudden it popped.
Yeah.
And I got scared. And then I realized, oh my God, I have no pain. I didn't know how to react.
Mm-hmm. Right.
Because I've been in this pain for 50 years.
Right.
So I was giddy. I was so happy and so giddy that I could be out of pain without taking drugs. When I move my head, I have full movement. I I was shocked.
I'm going to go get the plug in because it's running out of batteries. If you were talking to someone and trying to convince them it was worth giving me a chance at taking them out of pain, what would you tell them? I'll be right back.
I would say, please go see him. Just talk to him. Let him know what your problem is and give him a chance to show that he may be able to help you. I'm telling you, he has changed my life. And I am out of pain. I have been paying 50 years. You got to remember, pain changes you. So if you want to feel like you may have a chance of getting off all the drugs and everything else, that the heat packs, everything else, please go see Dr. O'Connor.
Yeah. Connor's down there.
He can help you. Give him a chance.
Now, I've done some other things for you, too, that aren't necessarily related to your back specifically, but enough for you to kind of evaluate that I'm not a flake, am I? I'm a pretty good doctor all around, besides just my back program. And so I know I was able to figure out what was happening to you when you came in and all you wanted was something for a procedure or something like, I forget exactly what. You wanted something because you were going to go and get something done.
I was going to have teeth work done, and
right.
I was getting so high anxiety about it. I wanted something to calm me down because it was going to be a 2-hour procedure.
Right.
So you gave me a little bit of Valium just to relax me, to sit in the dentist chair. But what happened at that point, when I didn't realize myself the anxiety and the stress that I had been in, and Dr. O'Connor glommed on immediately, and just he knew it was going to be more than just a little visit. He knew there was something going on, and he sat back and he listened.
Did you ever have a doctor extend that level of care to you?
Never.
That you can remember?
Never.
Was it successful?
Fabulous. He went into something else that was going on with me and brought that out with even not my knowledge. So, and it was very quickly that you knew that.
Yeah, I'm pretty good at what I do.
The diagnosis was very quick. I was kind of surprised that you glommed onto that so quickly. And, I mean, you changed my life again, knowing that I've been depressed all these years.
Mm-hmm.
And all of a sudden, I feel like I'm getting back to normal with everything.
I do that all the time. I mean, I'm actually pretty good at what I do.
Yeah.
And I probably have a few, I've got some years left, but I think I'm underutilized. I really do. I could probably help a lot more people, especially people with neck pain like yours. There should be a line out the door around the block.
I agree.
And I should have a number of assistants working on people and doing what I do for a lot more people than the people I can advertise to, or what are able to read or hear about me, because they don't believe me.
It's hard to get people to buy into it.
Right, because they've been programmed that they can't do it themselves, and there's no help for you. That's it. You're just going to have to settle for the medicines that will give you some relief, but it's an incurable problem. You're going to suffer the rest of your life. It's not true.
I never thought I could ever be helped because of how they treated me for 15 years at the Arthritis Foundation.
Oh, the foundation. Oh, my God.
It's like, and I thought I was at the best of the best. And I mean, people are hard to convince, and but if they would just listen to people like me who know how you changed my life, emotionally, physically, and...
One thing is, a lot of people put the cart before the horse when they say that the reason you're not getting better is because you're depressed. You see, you have psychological issues that most people with this problem don't have that much pain. So there's probably some psychological things, and we're going to send you to somebody to work through that, and they send you to a psychologist to study your issues, because they believe that the reason you're in pain and you're not responding to therapy is because you're depressed. Well, it's the cart before the horse. In reality, is if you have that level of pain and you anticipate what next week is going to be like, or the future is going to be like, all you see is, oh my God, I hope this pain doesn't increase. I can't even tolerate this now. If I can't do this, if it gets any worse, I won't be able to work. If I don't work, I don't pay my car payment. Don't pay my car payments, I can't work. So I lose my job.
Exactly.
Then if I can't make my house payments, I'll lose my house, and I'll be a bag lady. And so all of that works into it, and so that when you get a little twinge, you go, oh my God, is this the paralysis? Has it finally gotten to the point where it's ate into my spinal cord, the bones or spurs or whatever? Am I going to be a cripple? Am I going to be in a wheelchair? And your mind just goes crazy with this fear. And you're miserable and you're depressed. Go figure. You know what I mean?
Yeah.
And
I mean, my future
people
looked very grim.
I take people out of neck pain or back pain, and boom, they're new people.
That's how
it changes everything. It's just like I no longer have this Joe Blindston cloud hanging over my head of doom.
Exactly.
It's like I don't feel that anymore. And it is pretty amazing how being able to actually fix people, I can solidly say it's not that they are depressed and that they're responding to their pain differently than other people. Is if you had that pain, you would be depressed too.
Right.
You cannot not be depressed and irritable and frustrated and short-tempered and all of that, because a person living in pain is miserable. I don't care what anybody says, they're miserable.
Yeah, and then on the drugs makes it even worse.
All they do is
because it goes into another cycle.
You have to take more and more and more and more.
That's
which
right.
I agree. Narcotics should not be used in these type of situations.
I know.
It's a mechanical problem, and it has a mechanical solution. Now, you would agree because you personally felt that mechanical solution. It wasn't magic. I didn't wave a wand over you or pray for you or do some strange and bizarre voodoo. You felt click, and guess what? There was instantly no pain, because I physically moved a piece that was pushing up against the ligaments that was causing that pain, and it had been there, wedged out there for 50 years. And the nice thing about it is it doesn't weld down and scar up and you don't get to put it back in. It is most of the time being able to put back. I can put 90% of the people who come through the door or better walk out with that relief.
Well,
now, who's going to believe that? Who is going to believe that some clown in Vacaville represents the 90+% of the people who walk in his door with pain that's been there for 10 years and they've been to every neurologist, is going to have them walk out an hour and 45 minutes later pain-free with full range of motion? It can't be done. Tell a doctor that, can't be done. The guy's a fraud.
Yeah.
He's a charlatan. If he's saying that to you, he's a liar, because nobody can do that. Okay, give me 20 patients and I'll give you back 15 that are pain-free and full range of motion in 40 minutes of it. But guess what? Nobody wants to do that. I've written to universities. I've tried to get people interested in doing a study like this. They're not interested. They don't have the time. I get it. I get it. Are you going to turn down $50 visit profit every 3 months when the person has to come back for their prescription?
That's exactly what they did to me for 15 years.
Let me tell you something. I have represented to all the primary care doctors and said, you got somebody with back pain? Send them to me. I'll take them out of back pain. If you really want them, just bring them to me. You know, I don't get referrals. You know why?
I don't understand.
You know why? That. Because I'm not going to send my bread and butter to somebody else. I'm not going to.
And that's not the pharmaceutical companies.
And these societies like the Rheumatoid Society or whatever, and they have their website. They don't want me to tell people about how they can get relief. You know why? Because then they aren't going to come to their website, and they aren't going to have their little blogs and their little conversations. Oh, sweetie, I was in pain like that, and here's what I do. I take a ice cold blah, 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 and they just commiserate with each other. And when I told them, here, go to my website, I'll give you free access. Oh, what's the heck catch? Oh, you charlatan, you're just trying to advertise. We'll cut them off. So they cut me off. They won't let me even give it away free.
Oh,
They won't even let me give it away free.
Well, you know, and then I came back to you a second time for the left side of my neck. I thought, oh, what is going on? You found out I had another disc out of club.
Yeah.
So you did it gently in an hour or so, just on your couch, and showed me.
Taught you how to do it yourself.
Showed me how to do it, and how I can keep my neck in place.
Right.
So.
Okay, well,
Fabulous.
you wouldn't mind if I put this out on the internet for testimonial purposes,
I
would
want
you?
the world to know.
All right.
I want them to know you.
Thanks a lot. Appreciate it.